Hi, I'm Dr. Cassandra Whitmore.
And I'm Dr. Kermit Jones. We're here to answer questions from our patients about how to keep themselves and their families safe during the COVID-19 pandemic.
Can you talk about how COVID-19 affects our African American patients in our communities of color?
Well, we know that African Americans are about 3 times more likely to get COVID-19 than white Americans, and about twice as likely to die from the virus, from data from the Centers for Disease Control.
Why are communities of color at greater risk of infection from COVID-19?
Well, part of it can be explained by some of the issues with respect to the history of racism in this country and issues regarding their African Americans' decreased access to some of the healthcare resources and environmental resources. And in this situation, what happens is we're almost facing a double pandemic of dealing with racism and then also the COVID-19 virus.
I agree. It's known that our African American members are less likely to have jobs where they are able to work remotely. That puts them at higher risk for contracting the COVID-19 virus. Also, many of our African American members and communities of color live in multi-generational households. With more people living at home, it's harder to socially distance.
Absolutely. And many of our patients have pre-existing conditions like diabetes or heart disease, and this puts them at increased risk of having bad outcomes from COVID-19 as well. But at Kaiser Permanente, we're working hard to address these health inequalities so that everyone has the opportunity to be their healthiest.
So what can our patients do to protect themselves?
Well, I encourage everyone to practice all of those preventive measures that can help stop the spread of the virus, such as wearing masks and socially distancing and washing their hands. But I also tell my patients that have some of those conditions that put them at higher risk to make sure that they are taking their medications and following their doctor's advice. And as COVID-19 and the flu start circulating around the same time, to make sure that everyone over 6 months of age, that they're getting their flu shot.
I also tell my patients to talk to me about any concerns that they may have in their health care and to partner with me because we're here to help.
So we realize that many people still have to get to work. So how do people keep themselves safe if they have to take public transportation or they have to carpool to get there?
It's hard to stay 6 feet away from each other when we're on the bus or in a car share or on the train. So the measures that our patients would need to take is to always wear a mask and try to stay 6 feet apart from each other. It's always best to carry hand sanitizer and cleanse the hands after touching any surfaces, and remember not to touch their faces. Always wash their hands when that's possible. If they have to carpool, they can ride with the windows open for more ventilation, and everyone should wear a mask in the vehicle.
And it makes sense that everyone should be asking their employer what types of things they're doing to keep their employees safe.